Good evening, I'm Stephanie Mills. Welcome to Ask the Specialist. Tonight, we ask the physical therapists on WCMU Public Television. Welcome back to tonight's show, Ask the Physical Therapist. Right now we are joined by our experts Manish Bandali with Central Michigan Rehabilitation and Kyle Mason with Mountain Town Rehab. Thank you both for being here tonight.
Thank you.
Now before we start, Manish, why don't you tell us a little bit about yourself and your areas of specialty?
I have been a physical therapist for the last 16 years, and I specialize in orthopedic manual therapy, and I deal with a lot of orthopedic clients with pain management and post-surgery rehabilitation.
Okay. And Kyle, why don't you tell us a little bit about yourself?
All right. I've been practicing for 2 years, mostly with orthopedics like Manish, and see a lot of post-operative patients, a lot of people that are just dealing with musculoskeletal issues. So anything from knees to elbows to necks, and yeah, that's pretty much my specialty.
Cool. All right. Thank you. Now, if you have a question for our experts tonight, it's really easy to get it to us. There's a couple different options. You can call the 1-800 number that's on your screen right now. That's 1-800-727-9268. You can also post your question on our Facebook page called Ask the Specialist, or you can tweet us your question at WCMU_AskThe, and you can use the hashtag AskThe in your question to get it to us. So starting off with tonight, let's talk about physical therapy. What is physical therapy, and what does it consist of? Manish, we'll start with you.
Physical therapy is it's a complementary to regular medical treatments in which there's some need for physical intervention. We use a lot of physical modalities, a lot of physical agents that helps with the treatments. We use a lot of physical agents like heat, cold. We use ultrasound, microwave, shortwave, and electrical stimulation to help body heal by decreasing pain. And physical therapy was started after World War I, after the trench wars, when the medical community needed somebody to take care of all the wounded veterans. And that's how we got the start. And now, in the last 100 years, the specialization has turned into a very independent profession.
Cool. Did you want to add anything?
Yeah, I'd just say that it is really an exciting field, and it's far more diverse even than a lot of people maybe even take the time to look at first glance. Dealing with anything from traumatic brain injury to a sprained ankle, and so there's a lot of opportunity, not just with orthopedics but across the board, even with burn care and neurologic patients. So the types of people that physical therapy can help is huge, and just helping address whatever it is that they're dealing with to restore function, whether like I said, it's has to do with anything from wound care to returning to sport. So.
Okay, cool. Well, we've got our first question. This is from a caller in Atlanta. I say my knee hurts when I go up and down stairs. Are there exercises that I can do to help it?
So my answer right off the bat would be there are likely some exercises that you can do to help it without having seen or knowing this person's history or whatever condition it is that they have. I think it would be difficult to say on air what those might be, but I think that it would definitely be worth having investigated, especially if it's kind of an isolated thing, such as having pain with climbing stairs frequently. If it's a mechanical issue, if there isn't any structural disintegrity, that physical therapy certainly can help.
Okay.
Definitely, knees a lot of things can be prevented by exercising, and physical therapy can complement that and point the patient in the right direction to do certain kind of exercises. And there are several major muscle groups that are involved, and if we strengthen that, that will definitely decrease the pain.
Okay. It looks like we have a question from social media coming in. Viewer wants to know, what is an ACL injury?
All right, so this would give you a good time to use the model. This is an illustration of the knee. This is a right knee you can see here, and so this would be the kneecap and the two major bones of the lower leg and the upper leg articulating here. And if you turn around to the back side, you can see that there are a lot of structures holding the two bones together, and they're all kind of lending stability in all directions. So any forces that are being transmitted through the knee, either side to side, front to back, can be handled and absorbed by the body. So if you look at the back, you can see inside the knee, between the two condyles of the femur here, are the cruciate ligaments. So the anterior cruciate ligament and the posterior cruciate ligament sit right in this space here. And so what happens is, what the anterior cruciate ligament does is it provides this forward migration of the lower bone, the tibia, on the femur. And so anytime that there's a tear, or whether it's a full thickness tear or a partial thickness tear, it decreases the integrity of the stability of the knee, and allows too much play between the two bones that are creating the knee joint.
Okay. Cool, thank you. A caller from Mount Pleasant wants to know, what can you do for an arthritic shoulder? I've tried ultrasound, heat, and cold.
For arthritis, the best treatment is to move the joint, because arthritis is, in a simple term, all our joints are lined by a cartilage, and the problem with the cartilage is it doesn't have very good circulation. It gets its nutrition when you move the joint, and with arthritis, it's a catch-22 situation in which we move less. The cartilage deteriorates more because we don't move, and because we don't move, the arthritis gets worse. And to get out of the cycle, need to do some range of motion exercises, but at a pain-free range. If it hurts, it doesn't help. That's the basic concept. But you got to keep moving as much as you can, and gradually you should be able to get back the function.
Okay. Another caller from Atlanta is, I have a connective tissue disorder. Is there any exercise I can do to raise my diastolic blood pressure that I can do with my disorder?
Connective tissue disorder, I think everything that connects one bone to another, or one muscle to bone, is all connective tissue disorder. It's pretty vague disorder. I would need a little bit more specific on what's causing the problem.
We have another question from social media. This one coming from our Facebook page. What are some treatments for painful Achilles tendonitis?
So the gross diagnosis of Achilles tendonitis is typically pain in the heel, and so it sometimes needs to be differentiated whether or not it's an acute inflammation that the tendon is actually irritated because of some event close in time that is causing inflammatory response, or is it more of a long-term change in the tendon because it's been repeatedly exposed to abnormal forces. So it's hard to say without knowing for sure if it's actually just a tendonitis or more of a tendinosis, which is a long-term thing or a long-term condition with regards to the tendon. But typically, one of the first things that we do is take a look at the mechanics of the foot, and if this were in fact the case, frequently, even just some calf stretching and icing would be frequently prescribed as the initial home exercise program. But again, not having seen the for sure if it is one or the other, it's difficult to say.
Sure. Okay. A caller from Remus asks, Is there any physical therapy for the sciatic nerve?
Sciatic nerve, we see a lot of cases with sciatic nerve and lower back pain. Sciatic nerve starts from the buttock region all the way down to the legs, and there could be several reasons why it's painful. There's several different areas where it can be impinging. It could be impinging right at the base of the spine where it's coming out, or there's a muscle called piriformis in the buttock area that can be impinged. And there is a lot of different treatment options available in physical therapy, including ultrasound, stimulation, and manipulation to help with that.
Okay. Caller from Detroit, is there anything I can do about fluid on my knee?
So fluid on the knee, just speaking in broad terms, if it were an actual, joint-related issue where there's actually, local swelling or effusion of the joint, which is swelling inside the joint, making it tight, and which may be the case if it's a meniscus injury or something like that, is difficult to say. Icing, of course, is occasionally helpful, but compression frequently will be, I would say to get it maybe looked at a little bit further, if just fluid on the knee is maybe a difficult
Sure, okay.
thing to address.
Another caller asks, what is the best exercise for someone with fibromyalgia and neurofibromatosis?
Fibromyalgia is a pretty complicated syndrome because it has variety of areas affected. Slow rhythmic stretching and low-grade exercise is the normal prescription for it, and it can main thing is for a patient not to lose heart, and finding the right balance of activity and rest is important. Inactivity definitely leads to more problems than it solves. So it's and with fibromyalgia, because of excessive firing of the neurons, and it creates a lot of pain when they do a lot of activity. But inactivity is definitely the worst thing that you can do.
Sure, okay. Well, we have a lot of questions coming in. Again, you can get those to us by calling our 1-800 number. It's 1-800-727-9268. And you can also post a question on our Facebook page called Ask the Specialist, or tweet us your question at WCMU_AskThe. Now we have another caller from Baldwin this time. They say, I fell and hurt my knee and pelvis. My pelvis is rotated anterior. Is there any exercise to rotate my pelvis?
Yeah, there are certainly things that can be done to fix rotations of the pelvis, and frequently, if there is actually a bony rotation, there's soft tissue things that have also happened in maybe accommodation for pain or whatever else. So more than just addressing the actual rotation of the pelvis, it's going to involve, some stretching and things in order to restore length tension relationships that will support, normal anatomic alignment. So a single stretch or a single movement or exercise may not do the trick, but if you get in to see someone, I think they could likely give you a more comprehensive plan to address the issue.
Okay. Another caller asks, how many times can you get a cortisone shot for an injury before you get negative side effects?
That is an interesting question. In the United States, we are pretty more lenient with cortisone shots, but usually 2 injections per joint in your lifetime was what I was taught in India and European system. Was enough. Definitely having it too many times could be detrimental to the joint.
I have have a caller from Flint say I have drop foot from a spinal cord injury. Are there any exercises I can do to help this?
Yeah, depending on the severity of the nerve damage, there is maybe potential for strengthening, but depending how much actual damage there is, it's likely that in that case that the stimulus to the muscle just isn't adequate in order to produce enough force to resist the slapping of the foot when the heel hits the ground. And so I would recommend to that person maybe if they could see someone to get them set up with an AFO or something that would help them to walk more normally if, strengthening is less than adequate.
Sure.
There is some new neuromuscular electrical stimulation units that are available that can also help with that. And exercising definitely will encourage just normal circulation in the muscles and getting them more stronger.
Caller from Shelby, I have a torn meniscus. Can physical therapy help? I can't have surgery because of blood clots yet.
Yeah, it can definitely help. Depending on the type of the tear and where the tear is, as far as the anatomical alignment of the meniscus, there is either some or no potential for it to heal, but it doesn't mean it necessarily just because even in a case where it couldn't heal, it doesn't mean that it can't help. Optimizing the joint mechanics and lower extremity alignment by even strengthening regions that are surrounding the knee can often be enough to decrease the load on irritated structures and improve function and reduce, if not eliminate, pain.
And there has been some new studies out there that are saying that even physical therapies even has similar outcomes as a surgery. Yep. So definitely doing physical therapy will definitely improve the pain.
Okay. A caller from Oil City. I have a herniated disc on my MRI and my calf hurts. Do I need surgery?
So I would say that there's no way to say for sure whether or not they need surgery, but I would also caution that all MRI findings are not necessarily indicative that that's the origin of the pain for sure. Now some are pretty conclusive. Others, depending on how they were taken, if they're weight bearing or whatever, they can really be taken as maybe the sole cause of whatever symptoms that the person is experiencing. So just be cautious of MRI findings that they can certainly, and I'm not downplaying, especially if this person was told by their physician that it's likely that their symptoms are coming from their back, that's not the case. But just there are several other things that can impact both the position of the disc and how the interaction of the spine and the disc and the nerve roots are all coming together. And so just having that little piece of information isn't enough to say for sure that this person is going to have surgery. And there's certainly probably a lot of things that this person could do prior to trying surgery to address their problems.
Okay. A caller from Gaylord asks, 2 months ago I had a shoulder replacement. They had to do it reverse. How long should it take to rehab?
Reverse shoulder is a pretty new concept. It's basically done in which the normal replacement means, if I may use the prop with the shoulder, this is the right shoulder, and it's a ball and socket joint. We have a ball and we have a socket, that is the shoulder blade. In reverse arthroplasty, the things are reversed. The humerus, the long bone, becomes the socket, and the scapula becomes the ball. And that reversal does limit some motion, but I have seen few cases in which it has helped with the pain. Rehab time for any shoulder surgery is usually pretty lengthy compared to other joints. So 2 to 3 months is a pretty normal time frame for that.
Gotcha. And a caller from Cadillac, they have a torn rotator cuff, had surgery with 3 months of physical therapy. Any at-home exercises that would help?
Oh, yeah, there are probably some stretching and strengthening exercises that they could do. I would advise them probably to consult with the therapist that they had from their previous episode too, because they would be far more familiar with their case than I would be. But I'm sure that there are some things still at this point, if it's only been 12 weeks, that they should be doing in order to address probably some strength and, kind of mechanical deviations that are likely there too if there's any motion missing.
Sure, okay. Caller from Mount Pleasant. I received an electrical shock at age 18. I'm 57 years old now. Could this be causing my arm pain?
Electrical shocks are very notorious because the only visible wounds are from entry and exit. And there could be several things because all the voltage went through the body. So they are very difficult cases. And yeah, there is a good possibility that arm pain could be related to that or it could be something else totally.
Okay. Caller from Gladwin. How do I get rid of pain on hip, on lower back, right side? They have taken cortisone, Vicodin, but they're still in pain.
Yeah, so there are a lot of structures that could be at play there, and they are also really intimately related. The hip, the SI joint, the lumbar spine, all are so close, in close proximity within the body that likely they're all playing off of each other, and there are deficits in each region that at this point, if it sounds like the patient or this person has been laid up for a little while, they're probably going to need someone to have an eye on it that can really pick apart, the components coming from each place to be able to set them up with a good plan. It's unfortunately, and I'm sure Manish can speak to this too, is if it were as easy as giving some advice over the TV to take care of some pain, we wouldn't have jobs. So.
Sure.
That'd be my answer.
Gotcha. All right, thank you. Caller from Westland. I'm 92 years old. My knee is bone on bone. I've had cellulitis and blood clots. Should I have a knee replacement?
That will be
It's age 92?
age 92.
Yeah, probably.
Age is not a barrier, but definitely should get the clearance from the doctor because cellulitis is an infected condition and you usually don't want to do any elective surgery. But definitely they will need a medical clearance before they can.
Okay.
So.
Caller from Luther. I have nerve pain that radiates from my neck to my head. Massage helps. Can physical therapy?
Yeah, frequently it can, and often in instances where there is pain originating somewhere in the shoulder or kind of the base, upper back, base of the neck, upper back region, that does respond to massage is a kind of multifactorial thing, that there's likely probably some muscles that are contributing to their pain referral as well. Okay. Infrequently there's, unless we're talking about like cranial nerves and things like that that are supplying the face, origins of pain that are coming through nerves. So it can also be muscles that are referring along those same pathways that can reproduce pain that's very, very similar to the feeling that it would be to have neurogenic pain.
Gotcha. Well, I don't know where this half hour went, but we are almost out of time. Thank you both for being here tonight. We got a lot of questions. We weren't able to answer all of them, but we're going to be posting those on our Facebook page. You can check those out tomorrow. But join us again next week when we ask the lawyers. For now, I'm Stephanie Mills. Have a great night.